Thank you, Chairman Buchanan and Ranking Member Doggett, and thank you all for being here today. The majority of my work in the healthcare space is really focusing on ensuring robust patient access to care, particularly for rural patients. I'm from West Virginia. In my district, the median household income is $52,742, which makes my district one of the most financially constrained in the country. 1.2 million people in West Virginia have at least one chronic disease. In a state of only 1.7 million people, that means that most West Virginians are on a tight budget already. Therefore, they also have to consider the potential high cost of managing their health. Biosimilars seem to be a great option that can help reduce patient costs, but it appears from your testimonies that we have some work to do, making sure that the patients and the providers are educated on biosimilar options, and the insurers are putting these drugs onto their formularies. Dr. Pat, sometimes it seems the determining factor in a patient getting access to certain therapies is the physician's awareness that the therapies exist. Is there a new biologic on the market that can save a patient money, but a physician doesn't know about it or doesn't really know how to explain it to their patients, so they don't recommend it? With growing patient and physician awareness of these biosimilars, have more patients been asking to switch? And if not, do you believe patient awareness of lower cost alternatives would incentivize them to ask to switch?
It's a great question. I do think that there is an educational opportunity, though I think that there is the medical community is well versed in comparison to a decade ago regarding biosimilars. And I'd mentioned earlier, but I think actually that conversation has gotten a lot easier, though there are other barriers that we face. So for example, if I have a patient that's on trastuzumab or Herceptin to treat metastatic breast cancer, and I talk to them about switching to a biosimilar product and I write for one, frequently the insurance company will prioritize, the pharmacy benefit manager will prioritize a specific biosimilar that we're underwater on, meaning that our costs exceed our reimbursement. That doesn't, we're not able to pick that choice because of viability. So yes, I think there's a role in education, but there are other barriers that I think lead to suboptimal utilization.
So between the patient and the insurance company, there needs to be better communication. Dr. Edgerton, what are the most common questions patients ask when considering switching to a biosimilar? Is cost the driving factor?
Typically, patients are most interested in the potential side effects of the drug. Is it going to be the same as what they've been on? And the efficacy. For our patients in rheumatology, these patients are typically on a biologic agent for many years, if not their entire life. So there can be consternation if they're on one particular agent and they're considering switching, or their insurance plan is mandating a switch. So those are generally the topics of conversation. When it comes to price, interestingly, I haven't heard as much from patients. I don't think potentially there's the understanding of how access can improve as these costs come down. And that is something I enjoy opening that conversation with them and in explaining that. But as we've said, a lot of that opportunity has been squandered because the formulary construction is not allowing patients access to the biosimilars. And when the biosimilars are favored on a formulary, the economics now are upside down because, as Dr. Pratt had mentioned, with backdoor rebates moving from the manufacturer to the pharmacy benefit manager, now the cost of the drug is actually higher than the reimbursement. So it's a very strange situation.
Thank you. Price competition is very important for patients, especially for the rural patients, such in my district. The Inflation Reduction Act included a potential pause in price setting for certain biosimilars, but the process is complicated and may not provide the predictability needed for biologic and biosimilar development. Mr. Burton, can you speak on how important clear and consistent lawmaking is for the development of a strong biosimilar marketplace?
Absolutely. Thank you for the question. So again, for a biosimilar manufacturer, if you're thinking about investing $300 million in a new lower cost product, you need predictability. You need to know that that market's going to be there 10 years from now when you actually get to the end of that race. That means you need to know you need to be able to guess what the market size is going to look like. It also means you need to know you're going to get adoption. So not only do biosimilars face all the issues we've discussed today, but the IRA puts in place what I think was a well-intended approach that will harm biosimilar adoption.
Thank you. I'm sorry, I have to yield back my time.
No worries.